It's not normal to be constantly belching after each meal that you eat or develop a huge belly that actually prevents you from buttoning your pants. That's just not normal, and that's more than having a sensitive stomach. In this video, I will discuss how these common symptoms of bloating and belching may be actually something a bit deeper, and that something could be called SIBO. So SIBO is small intestinal bacterial overgrowth. It's when there is an excessive amount of bacteria in the small intestine or the small bowel. The small intestine has a relatively low level of bacteria. It's supposed to be at its highest concentration in the colon. And when SIBO is present, there can be malabsorption issues. And when there's malabsorption issues, that can lead to further dysfunction. Aside from belching and bloating, SIBO can actually cause the following symptoms of abdominal pain, excessive gas, constipation, bloating, diarrhea, joint pain, fatigue, depression, and even skin issues. And SIBO can be caused by motility problems like constipation. It can be caused by pancreatitis, diabetes, and even diverticulosis. It can also be caused by immunosuppressive drugs or PPIs, proton pump inhibitors like Prilosec or Protonix. And symptoms of SIBO can consist of this constant bloating sensation, especially after you eat, along with belching, excessive gas, diarrhea, and even constipation. It can also occur in autoimmune disease like a celiac disorder. Now let me ask you this. Did you know that there are actually different types of SIBO? Comment yes or no in the section below. So there are 3 different types of SIBO. There's hydrogen SIBO, there's methane SIBO, usually associated with constipation, and then there's hydrogen sulfide SIBO associated with diarrhea. Now, anytime I see a patient that has this belching or bloating complaint, I will search for the root cause, not just treat the symptoms. And when patients experience gut issues, they're often told, well, they have irritable bowel syndrome. However, it's important to determine if they have IBS or SIBO or both. It's important to get the right type of testing, because with the right testing, you'll get the right type of treatment. This is when we use a combination of a breath test and stool testing. And combining the right nutritional protocols, maybe a low FODMAP, maybe a low sulfur diet, or an anti-inflammatory diet with the right botanicals like berberine or oil of oregano, usually results in a much happier gut and hence a much happier patient. So if you find this content to be helpful, let me know by liking this video below. And if you want to go deeper and learn more about SIBO and other chronic GI issues, I invite you to check out my webinar, What's Up With My Gut? Simply click the link in the description below. Take care. We'll talk to you soon. This is Dr. Michael K. from the Center for Functional Health.